All right, so I'm here with Ryan Hamachek from the Health and Wellness crew. Ryan, can you tell us a little bit about what you do here?
Yeah, so I serve as the Director of Wellness and Health Promotion here on campus at Seattle University. And the areas that our office addresses tend to be physical wellness, mental health, alcohol and other drug education, and then healthy relationships. And so for us, that's both sexual violence prevention, and then it's also sexual and reproductive health promotion. So we kind of cover a broad range of issues here in the department. We work really closely with our health and wellness crew, or HAWC, as kind of our student outreach and advocacy organization. So they put on constant events for their peers to kind of help around education, prevention, and then to provide some peer support.
All right, well, let's start off. Thank you for talking with me and talking about the National College Health Assessment. My first question is, can you start by telling us a little bit about the assessment and what it does?
Yeah, you bet. So the National College Health Assessment is a study that is done by a national organization called the American College Health Association. And so that's a national organization that really works to guide the work that the Department of Wellness and Health Promotion here on campus at Seattle University uses to kind of guide our practice. And it tends to be the association of people who do public health work on college campuses. And one of the things that they work to contribute to the field more broadly is a really strong research base to understanding what is the current state of health of students on college campuses across the country. And so the National College Health Assessment is that study that we're currently doing here on campus at Seattle U.
Who takes the survey? Can anyone take it, or is it specific to certain people?
Different campuses will choose who participates in the study in different ways. At Seattle University, we look at about 50% of our population. So we do a random sample that's demographically representative. So say we have 100 first-year students, 50 of those students would be selected, and that's done by our IRB on campus. So they're the ones who identify the participants. I don't even know which students were selected to participate in the study, but they then those names get sent to the American College Health Association, who then kind of anonymously distributes that study to our students. That's just one extra measure that we do to maintain confidentiality and participation.
So how do people and the students that are chosen, how do they access the survey?
Yeah, so if a student is selected, and at Seattle U, we are looking at all of our students, so undergraduate students, our graduate student population, as well as our students who are in the School of Law. We will send out an email to those students that gives them a unique link. We do this for a couple of reasons, but the primary one is that it actually helps ensure data validity. So we don't just have a generic link that's on a website, and so that prevents people from responding multiple times and increases our confidence in the study results.
So what sort of questions are asked of students in this survey?
The study tends to be a pretty comprehensive look at health, and the study just takes about 30 minutes to complete. So in about 30 minutes, a student who's selected to participate will be asked a number of questions, everything from just general health and wellness, how their current state of health is. It's going to include things like disease and illness, which things they've experienced in the last 12 months or within their lifetime. Specifically, it's going to ask students about academic impacts of those things, right? So if you've had the flu, has that impacted your ability to attend class or get a good grade? In addition to things like disease, it's going to look at violence and safety on campus. So how are students experiencing personal safety, lifetime or within the last year experiences of violence? We're also going to be looking at alcohol, tobacco, marijuana use, as well as a variety of other drug use, really trying to get a sense of what's going on that students wouldn't normally be disclosing to folks in non-confidential ways. We're going to be asking students questions about sexual decision-making and the behaviors that they choose to engage in, nutrition and exercise, mental health, and then just sleep. How are our students sleeping during this really busy time of their lives?
So for the students that are selected to take it, why is it important that they answer the survey thoroughly and honestly?
So the big thing that I would encourage students to consider is if they are selected as a participant, to just get started. Any student who is selected to participate has the option to opt out of any given question. So if there's a question that makes someone uncomfortable or they would prefer not to answer, they can do that. But if there are questions that they're comfortable answering, I just would encourage people to go through the study, because while someone might not be comfortable, say, sharing their sexual history, they might be totally comfortable sharing how many fruits and vegetables they're eating on any given day. So my encouragement really is for students to do that. And at the end, the importance of as many people participating as possible is just that it helps us get the broadest perspective on what's the current state of student health here at Seattle U.
And so for those same students, if they're uncomfortable answering it or if they want to, do they have some sort of anonymity, or do they have to sort of put it all on the table?
No, the study is completely anonymous and confidential. So we don't, for example, I don't know who was selected by our IRB to participate in that study. And the only data that we get back from the American College Health Association, and they're the ones who administer the study, the only information we get back is our aggregate data. So we get a full data report that says this many students responded in this way. Let's say that's around how much someone has had to drink in the last month. This many students said that they drank this much, but there would be no names or any identifying information associated with that. So the thing that we really appreciate about the study is that the confidentiality and anonymity that the study offers really allows us to get our most complete picture of what's going on campus, especially around some pretty sensitive topics, sexual violence being one of those. This tends to be the study that we look to best understand what our climate is related to sexual misconduct. And in turn, it allows us to then inform in really accurate, research-driven ways the ways in which we are going about prevention.
So I know you just highlighted a little bit about how you use the information that you receive, but for the other questions, or for, I guess, in general, what do you do with the data that you get back?
Thank you so much. Once we get the data back, we're going to do a couple of things differently this year. So first and foremost, we're going to try to break the data out a little bit more by demographic group. So we've always kind of looked at how are the experiences of our undergraduate students and our graduate and law students different. But what we're trying to do is really increase participation this year so that we're able to look at smaller demographic groups while still maintaining that confidentiality and anonymity that I mentioned. And so we're really going to try to get a sense of, when we say this is what's going on in terms of health on campus, is that only accurate to a particular demographic of our students, or is that really applicable across demographics? So, and we'll make the decisions on the specific demographics that we're able to break out based on participation and based on numbers of folks who identify in certain ways. Additionally, I use this data to communicate across the university what we understand to be the current state of health. So oftentimes I will present to the Board of Trustees or the President's Cabinet, the university's Board of Regents, so that they have access to really great and accurate information about what our students are experiencing. I then subsequently try to use the data to certainly guide the efforts of our office as an office that's working on prevention and education. But I can also then use it to seek additional funding for programs or initiatives on campus. Let's say I'm trying to hire a registered dietitian. Allowing or looking at this data and allowing data to inform that proposal is incredibly helpful. So saying that the vast majority of our students are not eating their 5 servings of fruits and vegetables, and students are expressing an interest in more educational opportunities are 2 really helpful data points that would come of the NCHA and have come in the past as I'm trying to advocate for additional resources or personnel. And beyond that, even if I'm not using it to seek additional programs, the Health and Wellness Crew, which is the student organization out of wellness and health promotion here at Seattle U, they use this data day in and day out. So this data will drive our programming for the next 2 years. We use it to determine what are the things that we need to focus our attention on. We determine which things did we previously need to focus on and now no longer need to address because they have kind of fallen in popularity or they have kind of fallen in frequency. So we're kind of constantly referring back to this data as we look to make really informed decisions on campus.
Thank you so much for talking with me. Just a follow-up. Can you tell us a little bit more about HAWC and if students want to reach out to it, what they can do?
Yeah, you bet. So HAWC, or the Health and Wellness Crew on campus, is a group of trained peer health educators. And so they go through a kind of rigorous training in the fall and are nationally certified as peer health educators. And they're just available for their peers. Really, they kind of focus in 2 main ways. The first way is just individual meetings and consultation. So let's say a student takes this National College Health Assessment and starts to have questions about, I wasn't actually considering how my sleep could have been negatively impacting my ability to be successful academically. I just need to talk with somebody to get some tips about how to maybe sleep better. HAWC is a great place to start. In the event that they're not able to answer questions or a student is looking for maybe a more clinical setting, the team is also trained then to make the appropriate referrals out. And HAWC is actually going to be in the process of recruitment this winter quarter for next year's team. So we recruit in the winter quarter and train in the spring and summer quarters so that students are ready and able to serve their peers in the fall term.
So if someone wants to come and visit HAWC, where are you located and how can they contact you?
Yeah, our office, again, is Wellness and Health Promotion, and we're located on the 3rd floor of the Student Center, Office 380. It's just across from the bistro. So folks can certainly either pop into the office. They can also find us online at seattleu.edu/wellness. Or they can drop HAWC an email at just HAWC, HAWC, at seattleu.edu. And that email will send to the entire team. So if someone has a question, it allows the team to respond in the quickest way possible.
Okay, well, thank you so much for speaking with me and talking about the survey as well as HAWC. Thank you.